When the certification program was developed, it was decided to have a track for both palliative care programs, the Advanced Palliative Care Program for hospitals and the Community Based Palliative Care Program for home care organizations.
The agenda will be similar to the standard agenda utilized on all full accreditation surveys. Surveyors will evaluate all services, including your CBPC, throughout the course of the survey. For example, the orientation to the organization will include time for the organization to explain their palliative care program or services. All services, including palliative care, will be addressed in the various system sessions, including leadership, emergency management, environment of care, infection control, and medication management. The data system tracer will specifically allow time for the organization to present performance improvement data and information specific to their palliative care population. That is a nice time for us to dive into the unique components of your program and look at your outcomes for this population. The credentialing requirements are more advanced than the usual HR file review, but we will include the credentialing of LIPs during the competency discussion. Time will be allotted to meet with the ID team members who manage and oversee the care of your palliative care patients. And finally, last but not least, specific time will be allotted for the community-based palliative care patient tracers. We will make a home visit to at least one of your patients receiving palliative care services and trace how care is managed for that individual. This allows us to see all the good things you are providing to this population. Our system sessions support our ability to evaluate the comprehensive structure of your program.
We are very fortunate to have two palliative care experts to present the practice guidelines. Dr. Diane Meyer, Director of the Center to Advance Palliative Care, or CAPC, and Dr. Kimberly Battle-Miller, a pediatric palliative care physician and the Medical Director of Hospice and Palliative Care for the Advocate Healthcare System. She is also a reviewer for the Advanced Palliative Care Certification Program.
All surveyors involved with the community-based palliative care program have previous experience with palliative care. They have received extensive training on the CBPC standards and been involved with ongoing internal and external education. They also have access to current research and palliative care data. This helps assure they are aware of and can share relevant and contemporary data with our customers. Their exposure to our customers has also been advantageous, as they have seen the many and varied ways organizations approach and structure their palliative care program.
For those that are thinking about building a community-based palliative care program or just starting out with a new program, this conference will be very beneficial. We will discuss various models that are being used by home care organizations to develop and provide community-based palliative care services. We will also hear from two guest speakers concerning regulatory requirements and methods of payment for community-based palliative care services. For those that are already providing palliative care services in the community and are considering CBPC certification, this conference is extremely valuable. We will provide attendees with important information on what to expect during the home care survey concerning the CBPC requirements. We will highlight the eligibility criteria and provide an overview of the critical standards in the community-based palliative care certification program. And we will provide an overview of the on-site CBPC certification survey process. The content of the CBPC track is being developed and will be presented by 3 members of the home care team that were significantly involved in the development of the CBPC standards and their survey methods. This includes one of our experienced palliative care and home care surveyors, one of our field staff directors, and myself as the project lead.
I think that the conference will provide attendees with information about the standards and offer ideas on how to meet the intent of the standards. There will be networking opportunities because collaborating and talking with your peers is also a great way to gain insight and develop relationships with other palliative care providers.
There are a number of things attendees can do to get the most out of attending the certification conference, but I will focus on 2 of these. First, it's a great opportunity for networking with other home care and palliative care providers. By taking time to talk to others at the conference, you can learn from each other by sharing both your successes and your challenges. Attendees in both palliative care tracks will have lunch at the same time, so you can meet with colleagues who work in various palliative care settings from across the country. Second, if you would like to take advantage of the opportunity to meet with our business development team and talk to them about pursuing community-based palliative care certification, you can call us at 630-792-5070 or write to us at homecare@jointcommission.org to schedule a one-on-one dedicated time with our associate director from the business development team, either the day before or the day of the conference.